Model for suicide that is normally, well, at least one of the most common ones, considers suicide as a complex event that's influenced by multiple layers of influence, starting in society. These are things that you can assess, obviously, through interviews or records review, healthcare policies, firearm policies, stigma about seeking care for mental health conditions, community factors like where people live, the types of resources that are available to them, organizational factors like the messages sent within a healthcare setting or insurance status, or organizational policies around opioids, interpersonal things like relationships between the individual who might die by suicide and the people around them. That could include healthcare providers. It could include their level of support from social media or from friends or from their healthcare providers. And then finally, very individual factors such as the person's level of pain, their history of medication receipt, whether they have dependence. There's a concept called psychache, which is sort of the total psychological pain that they are in, regardless of how you attribute it. And all of these are likely to have some bearing on the decision that a person might make to die. We came to think that these might be approachable by getting case histories from a unique individual, Ms. Anne Fuqua, who I believe is attending this call. Anne is actually an assistant to our study, but she's also a patient with long-term pain who lives here in Birmingham, Alabama. And for years, she had been privately tracking deaths by suicide, as well as other medical events that were reported on social media and in the many communities she participates in, and tracking them for herself, not for our research, as concerning issues that were not being discussed very heavily elsewhere. And we ultimately, some of her work was profiled by Maya Salovitz, the New York Times, at the beginning of this year, and she had hundreds of cases in which people mentioned suicide. And to Anne's credit, she tried to adjudicate how many of these were likely to be credible. So in this staged photo, it looks a little bit like the Last Supper. Anne is sort of instructing our research team to take this on. And that's what we wanted to do, but we can't just grab Anne's data, as you'll see. That's not really ethical.